Hi, Dr. Kimberly Bekemeier here from Cucamonga Valley Medical Group, just coming on to discuss a little bit about some social implications of the coronavirus and our children. And so I wanted to talk a little bit today about how do we approach coronavirus and that discussion with our children. I am a mom of two small children, so I have a 7-year-old and a 3-year-old boys, and my oldest obviously goes to school, and so he's starting to hear things at school. So how do we approach the conversation when the kids come home and ask, when our travel plans change, when we tell them we can't go to that movie or go to Disneyland? And so I think the first thing is making sure that we're not spreading that panic, and there is no need to panic. We definitely want to take this serious. We want to make sure we have respect for the virus. We have respect for the people that are at the front lines that are going to be taking this on, but not to create panic, more as an educational opportunity. So we want to talk to our children about hand washing. We want to talk to them about spreading germs, which usually little people are not good at, and they spread everything. So really talking about hand washing, having that little tune, that song where we can play for 20 seconds to make sure we're getting a good lather, we're using the appropriate temperature of water. And then also talking to them about things like covering the cough. Ideally, you can cover it with a tissue and throw it away. We talk about in the elbow. So all those are better than just out and about. And then lastly, one of the most important things that we have as parents, caregivers, grandparents, aunt and uncle, however you may be interacting with children, is to model the behavior. Are we having them wash their hands before dinner? Are we taking off our shoes when we come in the house? Are we having hand sanitizer in the car so we can use those after we've been in public places? And the last thing brings us to kind of a social conscious issue, is talking to our children about loving our community and talking to them about things like, it may not be you that's sick, but what if it was your friend, family, even a stranger? We want to instill that love in our heart, that we want to work together as a community. And that's as challenging as the situation is, it's an awesome learning opportunity for all those people who have young ones in their life to really use it as a springboard to talk about caring for those around you, even if you may not know them. My family personally, spring break's coming up for us, and we've had to pass on a long-awaited vacation to a nice sunny getaway because we felt like even if we didn't think we were truly at risk, we couldn't go and travel through airports and boats and all of that, possibly bring it back to our loved ones, people in the community, patients of ours. So just some things to think about. Obviously, we welcome your questions, your concerns at Cucamonga Valley anytime. You can reach out to us on our website. We have Facebook posts on some social media. Come in and see us if you need us. We'll keep you updated as we've got more information, but just wanted to give you a little highlight on some things that we can do with our little ones during this time to spread information and not fear. Thank you.